Hello and welcome to episode 76 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is squatting technique. How you can improve your squat, improve your performance, and possibly prevent lower back pain while doing so. If you missed episode 75, it was an interesting episode where we discussed when it is appropriate to consult a neurosurgeon or any surgeon of that matter for lower back issues, how to navigate that process, and how to ensure that you get the best advice possible so that you can ultimately avoid surgery, avoid invasive procedures, and resolve your lower back issues the right way. If you have not joined our private Facebook group, RehabFix Low Back Program is the name of it, and you need to join this group because you get to interact one-on-one with me. You can ask me questions. I post exclusive content in there throughout every week that is not posted anywhere else. And just by joining, you will be provided our step-by-step sciatica guide so that you can literally learn our process for how we diagnose and guide people around the world towards a pain-free, sciatica-free life. You can read our step-by-step process on our Facebook page. All you have to do is join RehabFix Low Back Program. Now, squatting techniques. There are two main techniques that I want to discuss with you today. One is a little bit newer, maybe in the last couple years, 3 years, it's been popularized. One is a little bit more traditional. However, I'm going to discuss how one body type might be better for one and a different body type might be better for the other. So, let me break down the first technique that has been used for quite some time, which is great for certain individuals, and this is the hinging first squatting technique. So many people struggle to maintain stability while they squat, to prevent hyperextending their lower back when they squat, to maybe not feel as stable through their low back and their core or their hips as they squat. This is a common issue. And this hinge first squat is really, really good for these types of people. Okay. So let's break this down. Most people, they just throw a bar on their shoulders, they step back, they go down. There's not much more thought to it than that. There's a way more thought that can go into it though. So let's go through a few step-by-step processes and then I'll focus on the main point of this particular technique. So with any squatting technique, it should always start from the feet. Okay? So you pick the bar up, you walk back, or maybe you're holding a kettlebell or doing a goblet squat or something like that. You walk the bar back. What do you do with your feet? Step one, screw the feet in. Okay? Imagine my hands, for those of you who are watching, I'm pushing my hands into the ground and I'm ripping the floor apart. I am rotating my hands, my feet away from each other. So it's like I'm trying to rip the floor apart. If I was standing on a piece of paper, let's say that was big enough for both of my feet to be on, I would want to try to rip that paper by pulling my feet apart, rotating them like a clock. Okay? That is going to engage my feet and significantly engage my posterior chain. Immediately, you will feel your hips engage. You will feel your glute med contract. Therefore, your low back will stiffen too. Okay, immediately you will feel more engaged to this. Then, step two, big belly. Expand that belly. We teach intra-abdominal pressure in our program because it is so important. We have weeks covering intra-abdominal pressure because it is so important. Learning how to belly breathe, then learning how to control that belly breath, and then learning how to brace and hold that belly breath, and then how to transition that into weightlifting. Those are chapters that we cover in our program. And it is so crucial. That alone, learning how to do that alone is a $2,000 tip. That alone could completely change your lifting style, your lifting habits, your lifting performance, and your risk of injury or resolving maybe any aches or pains you have while squatting or deadlifting in the process. It is that powerful. So, big belly. That's the step two. So step one, screw the feet. Step two, big belly, brace, properly brace. Now step three, here's going to be the main point of the difference between these two squatting techniques. So for this hinge first one, It's in the name. You hinge first. You break at the hips. The hips go back first. Then you break at the knees and you squat down. This is really good for individuals who have a hard time keeping their posterior chain engaged, who have a hard time keeping their hips engaged, and who have a hard time hinging, right? By breaking at the hips first, pushing the hips back, the initial load is going through the first joint that moves. So the load is going through the hips. The hips, they have our glutes attached, obviously. They're strong, they're mobile. Our hips and glutes can absolutely support the weight. Okay, so breaking at the hips provides this advantage. This is a helpful technique for people who do not have the best ankle mobility. Do not have the best ankle mobility we find. And even sometimes not the best hip mobility. Okay? This will cause someone to sometimes pitch a little bit more forward. It has a tendency to do that for some people, not all people, but some. But it does a great job at loading the posterior chain. And for people who are strong with that and who want to focus on that more, it's great technique for them. Hinging first. So the second technique, how is this different? Well, step 1, no different. Screw the feet. Get the feet involved. Step 2, big belly. No difference. Step 3, here's where it changes. Instead of hinging and breaking at the hips first and shooting those hips back and then descending into the squat, with this particular technique, what you do is you break at the hips and the knees at the same time. So you imagine that someone is coming up and pushing your hips backwards while also pushing your knees forwards. You push the hips back and the knees forward at the same time. There's been a couple cartoon animations here. It will show like a rope, like a lasso around your hips and a lasso around your knees. And someone is pulling the lasso on the hips one way and someone is pulling the lasso around the knees the other way. Okay, breaking at the knees and hips at the same time. This will be a better version for people with better ankle mobility and better hip mobility. Okay, if people with really good ankle mobility try the hinge first option, their bar path becomes broken. They kind of hinge and then they go down and then the knees come forward because they have so much dorsiflexion. And it's kind of this wonky, multi-pattern looking squat. For people who have much better ankle mobility, they should do the version where they break at the knees and at the hips at the same time. This will allow them to maintain a better upright position and is more ideal for their particular capabilities in regards to range of motion through the ankles and hips. This will be better for those individuals. So ultimately, what's going to be best for you depends on your ankle mobility and your hip mobility, right? It depends on just simply what feels more comfortable to you. Traditionally speaking, we think, hey, whatever joint moves first is the joint that's taking all the weight. A lot of people with sometimes sensitive knees, I am not saying squatting is bad for your knees. That is not what I'm saying at all. But if people have sensitive knees, sometimes if they break at the knees first, they'll feel the knees get a little bit sensitive. If they break at the hips and the knees at the same time, it'll feel a little bit better. And then if they break at the hips first, it'll feel the best. It typically is the best for people maintaining good pressure, maintaining all the load in the hips. But like I said, it will pitch you a little bit more forward than other squatting technique. The other one will people have better ankle mobility and hip mobility and maybe not sensitive knees or anything like that. Breaking at the knees and the hips at the same time, staying a little bit more upright, will probably be a better version for them. One is not right. One is not wrong. They are different, and you should find which one is best for you and which one makes your low back pain feel the best. For most of our clients, we teach the hinge first version. For most of our clients, they feel better with that version. For most of them, not all, for most. Because it loads their hips in a way that they're not usually used to. It makes them feel a little bit more stable, a little bit more engaged. Most of them feel better that particular way. So that is the one that we coach. But of course, as we go through our program with individuals, we customize this based on where they're at and how they feel. And we make modifications that are needed for that particular individual. So it is not all the same for their coaching cues and for their journey back into the gym in a pain-free, sciatica-free state. So if you are someone who's been struggling to get back into the gym, struggling to get back into squats, struggling to get back into deadlifts, and you're having a hard time, and you're looking at our YouTube videos, you're looking at our Instagram videos, you're listening to these podcasts, and you're like, man, I'm looking for the perfect pointer. I'm looking for that one tip to get me back in there and never have problems again. You're not going to find it. You're not going to find it. That's just the way that it is. Okay, you're looking for a silver bullet. And that's just not how it works with the body. That's not how it works with pain. That's not how it works with low back pain. All right. If you feel like you're guessing and you're just looking for that silver bullet and you've been trying for weeks, for months, maybe even for years, and you're listening to this right now, come on. It's time to ask for help. It's time to ask for help. Let us help you. Let us show you the path to success. Let us give you the path to success. Let us hold your hand step by step through the path of success so that by the end of our 6-month program, you're doing whatever you want without pain and you can forget about it. Just today on our private Facebook group, RehabFix Low Back Program, I shared a testimonial of an individual named Devin from Texas. He is only 3 weeks into the program. He had been dealing with low back pain for 5 years with some sciatica. And he actually said, he sees our page and he saw our testimonials and he did not think he was going to be one of those people with the drastic transformation photos, the ridiculous change that we see with some individuals in their ability to bend forward. Sometimes they can barely touch the knees and then they're touching the floor, right? Within a matter of, a few months, sometimes a few weeks. He said he didn't really believe that was possible. He's one of those now. We posted his testimonial on our page 3 weeks in the program. He commented saying he really did not believe that was going to be possible. He didn't think he was going to be one of those people. It's possible. It's because he committed and he took action. And if you're listening to this and you feel like you're spinning your tires and you're listening to these podcasts and you're just looking for that silver bullet, stop guessing. Stop looking for that silver bullet. Take our hand. Let us guide you. Let us take you step by step. Let us show you the path to success so you can get there as quickly as possible so that 6 months from now, you're looking back at yourself and you're saying, dang, I'm glad I did that. Dang, I'm glad I just got it over with. Man, I'm so happy I asked for help because you don't want to have 6 months of excuses and then turn into 6 years of you doing nothing because you're looking for that silver bullet. So if you would like our help, submit an application on our website. We will also provide a link for that application in the show notes. Join our Facebook group if you want to get more involved and ask me and my team questions and learn what this plan could look like for you, what your future could look. Join our Facebook group, RehabFix Low Back Program. Let us help you because we've helped, at this point, hundreds around the world find success, and you can too. It's just a matter of taking that next step. If you're watching this on YouTube, please like, comment, and subscribe. If you're listening to your favorite podcast platform, please leave a 5-star rating and review to help this podcast grow and reach more people. As always, move more, move in nature, move in the sun. Thank you so much for listening and have a great day.